study.
This patient is a known case of OSA, morbidly obese patient. In morbidly obese patients, the esophageal sphincter will be reduced, one. And secondly, there will be increased intra-abdominal pressures. And both of these criteria can, and position of the patient can, both these conditions can result in increased risk for aspiration and increased acid. And acid prophylaxis is an important criteria while
what about pre-oxygenation, Ria?
Pre-oxygenation is very important in this patient, in a morbidly obese patient, because already the FRC is reduced, total lung capacity is reduced. So we have to pre-oxygenate this patient either by asking the patient to take 4 to 6 vital capacity breaths in the beginning, then by a well-fitting mask giving 100% oxygen for 6 to 8 minutes.
What is denitrogenation?
Denitrogen is removing the nitrogen and filling the lungs with 100% oxygen. And in this patient for 6 to 8 minutes with 100%.
Cup should be arranged, and apart from this, I would also like to have an intra-arterial BP monitoring.
Why do you want the temperature probe for these patients?
Because it is very essential, because to maintain normothermia, if the patient goes into hypothermia, it may cause delayed, it may delay our extubation criteria. We may not we may not be able to extubate the patient, and the patient may, and the action of the drugs.
What is the type of anesthesia you want to adopt in these patients?
In this patient,
as it is a THR. So
in this patient, because of the major procedure and anticipated blood loss, I would like to have a hypotensive anesthesia for this patient.
What is extubation criteria for you, these patients?
Before extubation, we have to take an ABG. We have to make sure there is no electrolyte imbalance. We have to check the acid-base status of the patient, and then we plan for extubation. Extubation criteria: first, the patient should be completely awake, alert, head holding more than 5 seconds, hemodynamically stable, respiratory rate should be between 10 to 30, SpO2 of more than 90%, a complete reversal of the blockade, a TOF score of more than 0.9.
How do you shift the patient to the? What's your plan after shifting?
This patient needs to be shifted to a high definition care, which requires high monitoring. So we would like to shift this patient in an ICU bed to the post-operative care with.
This is a THR patient, so patient has to be how long in ICU?
Patient.
In the ICU, we need careful monitoring of this patient, because there's a high chance of desaturation, BP fluctuations, infections, DVT, etc. And
you want to give any DVT prophylaxis?
Yes, DVT prophylaxis and pneumatic compression stockings, or you can start on LMW, heparin, or fondaparinux post-operatively, antibiotic prophylaxis. And then this patient, the Aldrich, modified Aldrich score more than or equal to 9 is a defined criteria for shifting this patient from ICU to the room. That is, the patient is able, the mobility of the patient is being checked, able to move the 4 extremities or 2 extremities or none. The patient's respiration, she's able to take deep breaths, or she's having dyspnea or apneic, a score of 210, and the circulation, the BP fluctuations, like more than or equal to 20 or more than or equal to 50. Patient is conscious, oriented, awake, alert, and the saturation, she's able to maintain a saturation of more than 90% without O2 or with O2. Or even with supplemental oxygen, she is not able to maintain oxygen saturation. So this is the modified Aldrich criteria, and a score of more than or equal to 9 is a confirmatory thing, shifting the patient.
So other than DVT, what all complications can be expected in the post-operative?
Post-operatively, the patient can rapidly desaturate because of OSA risk. Then we can, there may be hypotension, and because the patient is a hypertensive patient, BP fluctuations may be present. Then we have to surgical site infections. There is increased risk of infections, so prophylactic surgery, antibiotics should be started. DVT prophylaxis should be started. Incentive spirometry and deep breathing exercises also need to be started for this patient in post-operative care.
So CPAP also, if it is required.
Yes.
Okay, good. You answered almost all the questions, I think.
Thank you.
Thank you, doctors. Now, I request Dr. Aruna ma'am to kindly distribute the certificate of participation to Dr. Ria and Dr. Anup. May I now request Dr. Akka Mahadevi to please come onto the stage to felicitate Dr. Binil Isaac Mathew. I also request Dr. Sanish PJ to please come onto the stage to felicitate Dr. Aruna.